With the coronavirus still impacting our daily lives, a group of Texas doctors have released a chart rating the risk of various activities that can put you at a low risk or a high risk of contracting COVID-19. So exactly what should you be watching out for? Well, here to tell us is a member of the Texas Medical Association COVID-19 Task Force, Dr. Mark Casanova. Good morning. Thanks for being with us.
Good morning. Thank you.
Okay, so give me an idea how you came up with this chart, because I'm sure you could have gone through a whole list of different activities.
Well, what we did was overlay what we understand to be the activity of the virus, its transmission capabilities, whether activities were indoor, outdoor, the average length of time engaged in each activity. We assumed individuals would be practicing safe measures like mask wearing. And then we looked at normal behavior. So making the assumption that in a bar, enjoying an adult beverage, it's highly unlikely one's going to be wearing a mask. We incorporated all of those and created this ranking system with surveying COVID task force members as well as epidemiologists and infectious disease experts.
So in looking at some of the high risk versus low risk, did you find some surprises there? Were some activities you thought might not be, a high or higher risk actually ended up being in that category?
I don't know that there were surprises with the high risk category. I mean, what we saw was based on epidemiologic data of what we're seeing, not only in Texas, but across the nation. I'm sure you've seen it there in New York as well. What we did find after going through this pandemic now for 4 to 5 months is some of the previously felt to be higher risk endeavors fell to lower risk categories, or at least medium risk. For example, going to the grocery store. I think a lot of that has to do with safe practices, maintaining physical distancing and wearing masks that lowered the risk of some activities.
Right, exactly. So if you do take part in some of these activities, if you wear a mask, will that take it down to a lower risk area? That sounds like what you're alluding to.
Right, exactly. And that's what makes some of these previously considered to be medium to higher risk activities lower on the scale. But also within each activity, individuals can modify their own risk by practicing those safe measures and ensuring, God willing, that everybody else around you is doing the same.
So that's really the key here, though, right? And it's so interesting because in the beginning we were told, no, don't wear a mask. Let's save those masks for the healthcare professionals, which we understand, right? But had we been given that information, there's a lot of debate on whether we would be at this particular point had we all started wearing masks like many of the Asian countries do.
Correct. And I think there was, a steep learning curve with COVID-19 in those first several months. The answer is clear at this time. Universal mask wearing is key and fundamental to not only our health and well-being, but also our ability to engage in certain activities outside of the home.
Yeah, so let's talk about some of these states, Texas included, right? We've seen things kind of calm down here in the New York tri-state area, but Texas has seen an increase there. So what are you attributing to that?
Well, there's multiple factors. I think we began to loosen some degree of restrictions in a situation where our numbers hadn't yet began to decrease. So we simply had an increase in human engagement, if you will, encounters in a state where the COVID virus was still actively in our communities. That's probably one factor. It also, I'm sure, is affected by the fact that we had several holidays and situations where individuals were gathering in this time frame. We had everything from Mother's Day, Memorial Day, and most recently 4th of July. So I think we're seeing those consequences, as well as the fact that the virus has a normal sort of pattern of engagement in various areas of the country. So y'all had it pretty rough in your neck of the woods several months back, and now we're seeing other locales that are experiencing the virus.
Yeah, and we're also hearing that it can be also contracted via being airborne. So that's another thing to add into the mix of all of it. Appreciate you saying y'all. I haven't heard that in a while. Thank you for joining us, Dr. Casanova from Texas. We appreciate it.